I am reading a lot, and we kind of touched on this last time about how there are deaths being attributed to coronavirus that are a stretch to attribute them to coronavirus. And then you read that, well, the reason that a lot of hospitals all across the country are doing this is because they get more money for coronavirus deaths. Is that true? And who pays them for that?
Well, I don't know who pays them for that. That's the first thing. I'm sure that's done through insurance companies and through Medicare and Medicaid reimbursement. So,
right.
I can't tell you that for sure. I know that they're paying them a premium because of the fact that their business is way, way down. All the surgeries have been canceled, and elective surgeries have been canceled, and everything's been shut down. So hospitals are just bleeding money across the country. So they're being paid a premium for treating COVID patients. Now, do I believe that they are falsely labeling people COVID patients on purpose to get more money? No, I don't. I really don't believe that. I do know that they are testing. Most hospitals are testing everybody that's being admitted to the hospital for COVID, no matter what their diagnosis is. And if they test positive, then they're put on COVID floors to be treated as COVID patients. Because, needless to say, if they test positive, they're probably shedding virus.
Is it true, Todd, if I test positive for COVID and I get in a car crash on the way home and die, that I'm a COVID death?
No, absolutely not.
Okay, so that's a rumor.
No, yeah, that's a rumor. What's happening in a situation like this is that they allowed coroners across the whole country to make presumptions of COVID because testing wasn't available. Well, testing's widely available now, but the ones that they were making presumptions on are patients that had shortness of breath, fever, cold, flu-like symptoms, and died at home. And testing wasn't available, so they couldn't test them. So they were saying, well, all of the symptoms were consistent with COVID. They died as a result of this. You can list them as a presumed COVID death. So they were doing that. And we have not been doing that in Caddo Parish because, for the most part, we've had testing available. So we test everybody.
What do the death rates look like in, let's say, 3 months, 6 months, a year? It's not ever going to go away, right?
No, it's not going to go away. I wouldn't say ever, but I mean, at this point in time, it's not going to go away for quite a long time. So, the death rates, if you stop and think about it, Caddo Parish right now, we have 141 cases as of this morning of deaths attributable to COVID in Caddo Parish. But normally my office does 3,000 investigations every year anyway. So when you throw 100 on top of 3,000, our numbers are not getting swamped. Needless to say, there's an uptick from that. So the numbers aren't going to look that terribly bad. But yes, 141 people is a tragic thing to happen, but it doesn't overwhelm the system.
Okay, so what's our new normal going to be like?
Well, I don't think it's going to show. I mean, you stop and think about what is 100 compared to 3,000. It's a very small percentage wise. So if we had 200 cases a year on 3,000, that's a very small percentage uptick in what's going to happen. What you're asking, I think that it's a realistic question, is are we going to continue to have COVID deaths for some time yet to come? And yes, the answer is yes. We're going to have that. So there will be a very minuscule total volume increase over a yearly period. But yes, COVID deaths are still going to be on top of that. It seems to be picking out the elderly people with chronic medical conditions. And no matter what happens, even if we lift these restrictions, those people are going to be at risk. Go ahead.
The demographics I asked you about yesterday, African-American males, really high numbers. What's going on there? What do you know about that at this point?
Well, I mean, it's science there, and it's not a social factor. I mean, there are some social factors associated with it, but the bottom line is we know that this virus is very aggressive and high mortality rates in people with chronic medical conditions, diabetes, hypertension, congestive heart failure, obesity, all kinds of the issues that we normally see. if you look at the demographics, even before coronavirus, that those types of diseases are more prevalent in the African American community. So we would expect, even if we have 53% African Americans in Shreveport and Bossier, that number would be higher because of the prevalence of chronic medical conditions. So that's what we're seeing. Now, there are social factors, needless to say, associated with that make it more prevalent in the African American community, but the virus itself is not targeting African Americans.
Did I see also that Aaron had mentioned yesterday that the average age is also over the age of 70 for Caddo? Is that right?
That's pretty close to it. Yeah. What we're finding is that over 60 to 70 has a fairly high risk. 70 to 80 has a much higher risk. Above 80 is very, very high. And the mortality rate in people over 90 is extremely high. Well, what that's telling you is it's targeting the elderly, infirmed people. Even if we reopen on the 15th, the virus is still out in the community. The elderly and chronically ill people are going to be at risk. We've seen from the demographics that younger, healthy people are not really at risk. So what's going to need to be done is elderly people and people with chronic illnesses are still going to need to continue all the mitigating factors that they have done in the past, which is hand washing and mask wearing and social distancing and et cetera. They're going to have to protect themselves because the virus is still going to be in the community.
Okay, one last thing.
Yeah.
Are you seeing anything positive that you can share with us today?
Well, yes. I mean, if you look at it's not just me seeing anything positive. If you look at the number of hospitalizations and the number of people on ventilators, those numbers are going down. They keep reporting the number of new cases, and it doesn't look very promising because Louisiana, as a state, has flattened out, and we're at 1 or 2% increase over the last couple of days or whatever. But the problem, the reason that's there is because we're testing everybody now. We didn't have these tests available. So now that we're testing everybody and somebody comes positive, we're reporting that as a positive case. So the number of positive cases are going up. But the important number is look how many people are being hospitalized and look at how many people are put on a ventilator. And that number over the last couple of weeks has been decreasing steadily. So the number of people hospitalized are going down. It tells me that all of this is working. Reportable cases are up, but our number of people in the hospital right now is about what it was a month ago. The number of people on a ventilator right now is about what it was a month ago. Well, we reached a peak about 2 weeks ago. So we look like we're on the downside of that curve. Now, does that mean that it won't go back up again if we reopen everything? I can't make that prediction. I'm not an epidemiologist, but I know that the virus is still going to be in the community. So people are just going to have to continue to be smart.